Well, I don't have any idea about the virus you are talking about, but then I think if it is here, then there has to be a need of educating people about it as well. I think if it's a virus and it's around, I'm sure it's killing people in the system, so people should be well aware of what is happening around us nowadays too. So it's here, and the COVID-2 is here as well. I think it would be good that the government educates us more about this virus.
Yeah, I'm very much aware about the new virus that is fast spreading all over. And it's a caution to everyone to be careful, just according to the conditions given regard the COVID-19 virus.
Well, I just heard it, in the news that it's killing people. But it is a task for the government to make sure that, we take this announcement serious, because, when the COVID came, it's like more or less people were advised to take, some measures in order to use the masks and other things, washing our hands regularly and all those things. But here comes the case, this one too is becoming serious, something that is killing people, and you talk of zoology and all those things. And this is a sickness that we don't know whether we have the cure for it. So as much the government is concerned, much more, education should be passed on the general public in order for us to create much awareness on this.
I haven't heard of it. I only know of corona.
I didn't hear anything about that, so I am innocent.
Which virus? I've not heard about it. I listen to the news a lot, but I've not heard about it.
Actually, I've heard of it in the news, but I did not know much about it. And then just like COVID-19 came around, and then we were much educated, and then it was all over in the news. The last one I heard was the Omicron. So with the new one, I heard it in the news, but for the details, I don't know much about it.
It is today that I am really hearing about it. I actually haven't really looked at it, but I don't know why we are faced with all these challenges this time around, and I pray that our big men will try and do something about it.
So that's it from the general public on the Marburg virus, and we just stepped out to find out if people know about this new virus, which has already killed 2 people in the country. We'll be having a discussion here, educating you on what to know about the virus, how to prevent the virus from getting into your system, and what to do if you show any signs or have any symptoms. So I'll be speaking to Dr. Michael Owusu, who is with the Kumasi Center for Collaborative Research, and Dr. Franklin Essedu-Bekwe, who is with the Public Health Directorate of the Ghana Health Service. As you heard, a lot of people don't know about it, so we need to find out from the Ghana Health Service what's being done in terms of education. But let me just bring you some details on the virus. So there have been 2 cases confirmed in the Ashanti region, and unfortunately these 2 persons have lost their lives. So the process of confirmation of these cases these 2 cases in the Ashanti region. So on the 7th of July 2022, we had our preliminary findings from Noguchi here in Ghana. And there was a corroboration of the results. The samples were taken to the Institut Pasteur in Dakar, Senegal. And the WHO so far has provided external support for the transfer of the samples. 98 persons have been quarantined. There was contact tracing in the Ashanti and Savannah regions. And out of the 98 people quarantined, as of the last time we checked, about 30 of them have been sent home. They've been asymptomatic. Now, the Marburg virus is a rare but severe hemorrhagic fever that affects both humans and non-human primitives and fruit bats. They are natural hosts of the Marburg virus. What's the mode of transmission? Now, it's transmitted to people from animals, and it spreads among humans through human-to-human transmission from direct contact with body fluids, blood, and other discharges from the affected person or animals. So here are the symptoms, okay? Fever, bloody diarrhea, bleeding from the gums, bleeding into the skin, bleeding into eyes, and bloody urine. You need to pay attention to these symptoms. I'll go over them again. Fever, bloody diarrhea, bleeding from the gums, bleeding into the skin, bleeding into the eyes, and bloody urine. Now, here's how to prevent yourself from contracting the virus. Avoid exposure to mines or coverts inhabited by fruit bat colonies. Thoroughly check all animal products before cooking and consumption. Now, the WHO is expected in the coming days with a team of experts to assist Ghana fight the outbreak of the Marburg virus disease. Now, here's the support that will be given to Ghana. The team will provide coordination, risk assessment, and infection prevention measures in support of ongoing investigations into the latest outbreak of the Marburg virus. So once we set the tone, let's begin our conversation now. Dr. Michael Owusu is a virologist with the Kumasi Center for Collaborative Research. Good morning, Doc, and thank you for joining us. So we've set the tone for our conversation. Okay, there are a number of symptoms that we have shared for our viewers to know what to look out for. Some of them are very easy to identify, like blood in your stool, that's bloody diarrhea, that's a fever. But what do we mean when we say bleeding into the skin and bleeding into the eyes? What's that?
Yeah, so good morning to you and good morning to all your viewers. So the diagnosis of this disease is more clinical, and the physicians who are directly involved in managing patients are best placed to tell exactly how this looks like. But I believe that Dr. Abu-Baidoo may give some more highlight on how clinically you'll be able to see. But basically, I mean, at the cornea, around the eyes, if the vessels that are in the eye begin to swell, the eye become reddish. It's what sometimes you may think that is highly inflamed, and you may have blood leaking around some part of the eye. Bleeding to the skin also is something that is more clinical. So you could have some spots around, but I think I want to defer that question rather to a colleague physicians who have managed and handled these cases.
Sure.
They can better describe exactly how you can see. But the point is that these are the large stage or overt signs, such that if you see this, basically you know it's unusual, and you have to report to the facility. What we must be concerned about are the initial stages of malaria, fever, fatigue, and diarrhea that is like any other normal disease. Those areas are things that people may ordinarily see. But by the time we get to bleeding in the eye and bleeding in the nose, you will be rushed to the hospital. You cannot stay in the house and look out for this. But I hope that maybe my colleague physician can best talk about the actual clinical signs that comes with this.
Right, Doc. So we've been dealing with the coronavirus. Quite recently, we heard from the Ghana Medical Association saying that we needed to step up our efforts when it came to adhering to the safety protocols, because we're beginning to see a rise in the number of infections. Then we heard of the monkeypox virus. Now it's the Marburg virus. What is happening to our world? Why do we appear to be having all these viruses, all of a sudden? Is it a case that we're paying more attention now, or there really is a problem that we must be looking at?
Yes, so our world has been sitting on a time bomb for years, and we are only seeing what is now emerging as problems that we're beginning to experience. And let me take you back. In Africa, you know that different countries have recorded these outbreaks across. But even in the case in Ghana, the point is that, is it unusual? No. In somewhere 2011, October to December, the Amancia Western Ashanti region recorded 2 cases of Lassa fever. Lassa fever belongs to a family called the Bunya virus that is transmitted by mice. So when the mice defecate on food products, when they pass their urine, people get infected. So 2 people got it and died, and these were farmers. And they went ahead to investigate and found that the mice were the ones that were carrying the virus, and they were the ones that transmitted the virus. In Greater Accra region, as at 2004, 2009, a large number of investigations have been done to show that there are over 1 million food bats which are in the region. And they were screened, about 200 of them were screened, and some were found to have antibodies to Ebola viruses. And some have also seen antibodies to the Marburg viruses sitting in these animals. Even in Ghana, if you know, somewhere 2003, when the US reported their first outbreak of monkeypox, this was associated with about 812 small animals that were imported into the US from Ghana. And these were mainly squirrels and some rats and other things that were going to be used for investigation. So it was later traced back that these were the animals from Ghana that were associated with those outbreaks of monkeypox in the US. So some investigators came back to Ghana, investigated those animals, and found out that some of the animals, squirrels and some rats in Ghana, are also harboring this monkeypox virus. So the question about where they come from, they have been living with us in their own ecosystem, but then the human activities, we are invading into their environment. We are trying to get access to where they were naturally supposed to live. And as we get access to these animals and interchange with them and hunt for them, this is what the world is likely to face. So for me, I think that it's been something boiling over the years, and we are experiencing what human activities is living on, destroying of the forest, destroying bushes, mining in caves, and getting into areas that is not for human beings to live in. And if you ask me, I would say that this is why some of these things are coming up.
Doc, you mentioned that some of these animals were seen to have antibodies of the Marburg and the other monkeypox virus, right?
Ebola
and Marburg virus. Yeah. Does that mean we are in the process of either finding a cure or finding a better way to manage it? Because sometimes what we hear from the world of science is that antibodies help in finding cures to these viruses.
Yes, in the case of Ebola, because we know a lot about the virus and the fact that it has caused some outbreaks. As we speak now, there is a vaccine for Ebola. If you have read about the recombinant vesicular stomatitis virus that is attached to some part of the protein of Ebola. So for some of the outbreaks that occurred in places like Guinea and Uganda, they were vaccinated. And within a short while, the outbreak was arrested. So I'm sure in a short while, once Marburg is becoming a problem, I will not be surprised that vaccines will be designed very soon to help curb some of this. But in the meanwhile, whilst vaccines are not available and drugs are not available, I think the precautionary measures are very important. The COVID protocols, ensuring you wash your hand, ensuring that you limit the intake of bushmeat, especially in the communities affected, as much as you can. You have to reduce intake of bushmeat, especially things like bats, to try and then avoid it as much as you can. And also be vigilant to report cases to the healthcare facility. If somebody is bleeding, somebody is vomiting, and you don't seem to know what is causing it, just report to the facility, get the person there, and get them handled. And when somebody dies in your community, you don't keep the body and handle it in the way you want. So you expect the community to cooperate with the healthcare official. If they tell you that for this person that has died, the symptoms qualify as something that is due to viral hemorrhagic fever disease, and therefore your body will be kept from you and be further investigated. You don't have to get angry. You have to cooperate, because these are not normal times. If you trace the disease from Ebola and Marburg and stuff, the transmission route is most of them through handling of dead bodies. Because when somebody dies, the body becomes very, very infectious. So as you move the body from place to place, as you handle the fluids from the body, as you interact with the body, you are only allowing the virus to adapt to human transmission. And when it becomes very effective in that part, dealing with it will become very difficult. Now we have 2 cases, and it appears that the human-to-human transmission, I'm not sure is that efficient. And the viruses will have to learn. They must learn how to adapt to the community when they jump from animals to humans and then establish themselves before they can do it. And if you're able to close the gap immediately, you can stop the human-to-human pathway and now think about where we got it from. So this time is crucial. And people, the community, the public must help the public health division to be able to bring a stop or arrest this outbreak and then get us on free from this, and then we can look into the future on how to deal with this.
Yes, finally, Dr. Owusu, we know that COVID spreads fast because there was this whole debate about whether it's airborne or not, and so people were debating whether we should wear the mask. But thankfully, like you've just said, this virus is not as infectious from human to human as it is with COVID. However, the fatality rate is way higher. Finally, as you wrap up and as I introduce Dr. Isiedu Bekwe, what is the cause of this? Why do we have the viruses behaving the way they do, and why do we have some having relatively lower fatality rates than others?
Well, it's like saying that why human beings, some people get a disease and they fall sick immediately, and others get it and recover. Viruses have different features. They are classified by level of lethality and infectiousness and virulence. So if you look at the group of virus that does this, they are highly virulent. And virulent means that once you get it, it can attack many cells in the body, from the kidneys to the liver. Everywhere it gets, they have receptors there. They can attach, they can transmit, and they can destroy. So this makes viruses like Ebola, Marburg, and even Lassa fever and Crimean Congo viruses a bit difficult to handle because of their aggressiveness in causing destruction and causing deaths. So it's the nature, it's the behavior of it. But if you compare this to COVID, I mean, the good thing about Marburg and the hemorrhagic fever virus is that they are mostly through contact.
Hello, Dr. Owusu? Hello, Doc? Well, too bad. It appears we've lost Doc there. But let me introduce Dr. Franklin Isiedu Bekwe. He's Public Health Director of the Ghana Health Service. Good morning, Doc. Thank you so much for joining us. Let me start off with you on the symptoms. We've read out quite a number of them. Some are very easy to identify, like bloody diarrhea, fever. But what do we mean when we say bleeding into the skin and bleeding into the eyes, so that people just know what you're dealing with? Hello, Doc.
Thank you. Yes, thank you very much. So, I think I'm going to state that the bleeding is the end point of when you have the infection. So you don't normally have to wait to get the bleeding before you suspect.
Okay.
For an area that has the outbreak, the index of suspicion should be so high that even if you have a fever, that maybe is not resolving to the normal anti-malaria or antibacterial, you need to suspect. So I think that this issue about the bleeding is not a good guide. So it's a general kind of case definition for when you don't have an outbreak, then you need to use it. But for now that we have an outbreak, I think we don't need to wait for the diarrhea. I think that for the bleeding will be for community case definitions. Like if you want the volunteers to help you to identify or suspect cases, then you use that case definition. But for a clinician, you don't need to wait for it, because that will be the end stage of the disease. And there are a number of reasons why you are getting that. You have coagulopathies when you have the severe form of the disease. So anywhere that you can have the bleeding, it can occur. So any opening can have it. But I think that for this stage, we do not want to focus more on the bleeding. I think that the two cases, if you look at the history, I would say that the first one was missed because it was not a typical presentation for acute rheumatic fever. It was when the second one occurred, and then the interval is about a day, and they had a sample. So they said, could it be acute rheumatic fever? And that's how come it was picked. Because it makes sense. I mean, you diagnose what is common. So MARBURG is not common in Ghana. So a clinician will look for common things. So that's why they were thinking of an upper GI bleeding until the second death. Okay. And let me also use the opportunity to say that we sent an alert, and the alert has been good. I think that the clinicians are looking for it. They have gotten a few suspected cases, not from there, that have come out as negative. It tells you that clinicians are looking for rheumatic fevers that we diagnose. Yellow fever is one of them. So it's not that. We have a group of them, Lansah, MARBURG, EBD, Congo Premium. They are all, they belong to that group called rheumatic fevers. What is also I want you to talk about is that, we have 98 contacts. Now the contacts are into two groups. There's a group that was in Ashanti region. So that they were 50. So technically they have gone through their maximum incubation period of 21 days. So technically they have been discharged. Now we are looking to the one in Solar. So hopefully, I think they will be discharged tomorrow, because they would have also gone through the 21 days of monitoring. So we are still looking, but let me say that what we are doing now is merely trying to identify as many contacts as possible. So we keep on asking questions, probing to see whether there are areas that the cases would have gone to that we missed. And so that's what we keep on combing. So we keep on combing. So if you see any more contacts, it's because we are exploring more.
Right.
We want to be sure that we break the transmission.
Right, Doc. So these two persons who unfortunately lost their lives, do we know how they contracted the virus?
No, for now, the source of the infection is not known, because there's a history of the first one coming from Western region. We are trying to go further down to that community. There's nobody there who is sick, but what we are trying to do is that all persons in that small community of hamlets will also bring them on board as contacts. You see, if you look at the disease transmission or spread, is zoonotic in nature. So it could be from an animal to any of these persons, or could be from another person. For now, we keep on exploring. Hopefully, we'll get it. If not, what we try to do is to make sure we cut off the risk factors. So risk factors is either you are getting exposed to the infected animal, which was said by Michael, the main reservoir is a bat. So that, you see, it's not just eating the bat, which is a challenge. It's a contact.
All right, Doc. Okay,
so it's a hamlet.
All right, sure. So these two people, they aren't related. They are not from the same community. They never had contact with one another.
No, they are from two separate districts. One is from the Kwai municipal, the other one is from Adasi North. But they all went to the same hospital in Adasi North. So, and so far, we are not sure of any means that they came into contact. I mean, they are dead. So we cannot be able to ascertain whether they came into contact one with another. But for now, it's difficult to establish that. All we know is that they all came to the same facility 2 days apart.
All right, Doc. And the other thing is the point of contact you just mentioned. So we know with COVID, for example, we were told to, continuously wash our hands, don't touch your eyes, don't touch your mouth, don't touch your nose. Is it the same? Does this virus transmit via these entry points, or once it contacts your body, you're likely to get infected?
Yes, I think that the effectiveness of the infection it varies. But you see, what is somehow to me, which is good, is this one, you get an infection when the person is symptomatic. It's all like COVID-19. The person could be infectious but asymptomatic and spread it. So that is there's a big difference here. So in that case, the person might be showing signs and symptoms, maybe having a fever, or maybe having diarrhea, or maybe having the bleeding. And then when you are to contact, either by physical contact or by contact of the secretions, so be it blood or whatever from the body, when it gets into your skin, then or the mucous membranes, they can get it. So that's mainly the main root of infection.
Does it include sweat? Or it?
Yes, but it's minimal.
Okay.
So I think that the highest concentration is in blood.
Okay.
And but there are other so far as any secretion comes from your body, you may get it.
All right, Doc. Let's wrap up the conversation quickly. We before we started, we spoke to some people who say they have no clue what this is about. Unfortunately, we have not received as much education on this as we did with COVID, even though this has a higher fatality rate. Just tell us briefly what the service is doing in terms of education, and besides contact tracing, what you're doing to prevent the spread of this virus.
Thank you very much. So I think that for now, the outbreak is more of a local or localized outbreak. So the intervention tends to vary. So you have to have a higher dose at the area affected as opposed to the whole country. So the concentration has been more to the affected areas where we are focused more on the risk communication. But we are not going to expand so that the other parts of the country has information. What we've done is to have general press releases and general alerts, but the concentration has been to those affected regions. If you look at let's say the EVD of 2014, it was more of a pandemic. So we realize the approach is a bit different. It's all about the world, all about countries exposed. So when you are dosing the information, it's across board. This one, try to segregate it and concentrate more on where you have the infection. So our main goal is containment at source, so that we don't want to spill over to other districts. We have had a lot of, we are actually doing this response with our partners. And the issues about risk communication is going to be rolled up to the nation so that people in Accra, Takoradi hear about it. But we also want to make sure that the issues about case management is well enhanced. We are waiting on the COVID-19. We train a lot of clinicians in the COVID-19, monkeypox, and so we are making use of it. Try to make sure that we have isolation places earmarked. So assuming we get cases outside, that's where they'll be managed. So basically, those are the key things that we will be doing as a service while we try to expand this communication.
Finally, Doc, I witnessed at the Kumasi airport some officials of the Ghana Health Service stationed at the entrance, and they had computers in front of them, and it appeared that when people walked right in front of it, they could tell by color coding. I'm not sure what it is, whether it was temperature. What exactly is happening? Why are these people at airports? Is it related to the Marburg outbreak?
No, it's a thermal scanner. So they're checking your temperature. But instead of using the dark gun,
sure.
Well, as you go through it, the temperature is detected. So you can see. So if, let's say, your temperature is like 38, to flash red, you'll set you outside. So the thermal scanner.
Okay, and is this going to be constant? Are we going to have this happening at our airports?
This has been there not because of Marburg. It's been, I think for now we have it in almost all the airports. It's a way of monitoring temperature of passengers.
I'm grateful for your time this morning. Dr. Franklin Isidu-Bakwe is Public Health Director at the Ghana Health Service, and we've been talking about the Marburg virus. So you stay safe, stick to the protocols, wash your hands. The good thing about this, as we've been told, is you need to come into contact with a symptomatic person. So when you're dealing with sick relatives or sick friends, be extra careful. Well, shortly, Benjamin will be coming up with our guests to have a wide range of conversation on what's been happening in the country. The Afrobarometer report, 87% of respondents saying Ghana is heading in the wrong direction. We'll also be talking about what's been happening in Parliament. And as you may be aware, Communication Minister Esra Owufu-Ekufu, we are told, has not come to respond to questions, and this has happened for more than 5 times Chief Whip Muntaka Mubarak is upset about it. We'll be having our guest and Benjamin Akapo with that conversation shortly. Do stay.